Hello, everyone. My name is Ferris Asjalu. I am a public health intern for the Office of Community Outreach, Engagement, and Equity, and you're watching Let's Talk About It. Joining me today is Dr. Mullins, UT Southwestern's Simmons Comprehensive Cancer Center, Assistant Professor for the School of Public Health.
Hello, I'm Megan Mullins, and I am a cancer care delivery researcher, which means I'm not clinical, but I study ways that we can improve the quality and equity of the cancer care we give here at Simmons.
Thank you, Dr. Mullins. For 21 years, the National Coalition for LGBTQ Health has been hosting National LGBTQ Health Awareness Week to spotlight key health issues for LGBTQ communities and to promote accessible, affirming care. In honor of that, for this episode of Let's Talk About It, Dr. Mullins and I will be touching on some ways that Simmons is working on to bring sexual orientation and gender identity equity to the forefront to better understand our patients' needs and some exciting efforts that are underway. To start off, why is it important to collect sexual orientation and gender identity, other known as SOGI, information from all people with cancer?
That's a great question. SOGI data collection is important for several reasons. I think first, you've probably heard the saying, if we're not counted, we don't count. And so I think without this information, it's really hard for us to understand exactly what the needs are in the LGBTQ community in terms of cancer care, cancer prevention, and other resources that we may be able to provide. And so it will help with that. And the second is really so that we can start to provide more tailored resources when people do show up for their cancer care. There's a lot of things that we could do to be responsive to different identities, and SOGI will help us do that.
Great answer. Next question. What are some of the disparities or inequities that the LGBTQ community currently faces that you hope the SOGI work will help reduce the burden of?
Oh, yeah, that's a great question. So I think one that comes to mind is lower engagement with healthcare overall. That impacts cancer greatly. So things like not staying current on cancer screenings or later diagnoses due to just not regularly engaging with the healthcare system. And I think this comes from, a combination of things that include lower rates of health insurance, lower socioeconomic status, but a big one is really experiences of discrimination. Overall, LGBTQ folks report lower levels of satisfaction with their care. And this is partially due to providers who are unfamiliar with their unique needs and kind of a system that makes assumptions about whether people are cisgendered or heterosexual, things like that. And so I think SOGI can start to help make changes in these cases by raising awareness that we do have a large number of LGBTQ patients. These things are important to include as we're training clinicians and staff. And it gives us opportunities to then offer tailored resources to patients and also identify gaps where we can continue to improve care. So I think it's also really important to note that sexual orientation and gender identity data collection kind of opens the door for sexual health overall. And that's a big unmet need of many cancer survivors, no matter their orientation.
Yeah, so speaking of the change that you want to implement with SOGI, how are you planning to start this work here at Simmons?
Yep. So I'm really excited to be working with Cancer Center leadership on our SOGI data collection initiative. So we're currently developing training materials and documents to support collecting these data. As part of this, we're partnered with the National LGBT Cancer Network, and we're in conversations with many other cancer centers across the country who are also making SOGI data collection a priority.
Hmm. Just a follow-up question. Um, if Soji works here for the Simmons Comprehensive Cancer Center, are there plans to expand it to other branches of the UT Southwestern community?
That I think would be great. I know that we're starting with the Cancer Center because the National Cancer Institute has really made this a high priority for cancer centers specifically. And so I think that's kind of where we have the momentum. But I know across UT Southwestern, our goal is providing patient-centered care. So I think that would make a lot of sense.
Speaking of patients, can you help clarify how this information on patients' sexual orientation and gender identity will be collected and protected?
Yes. So for the SOGI data, we're going to be collecting it at new patient intake. And so it'll be collected with any other demographic information. And like any of your healthcare information, it will be protected by HIPAA. So that means that only people who need to know access your medical records for your care will be able to do so. So that's one thing. The other is that as a cancer center, we have non-discrimination policies that include both sexual orientation and gender identity. So you cannot be discriminated against for this information. And really the final protection is that, the robust training culture that we're trying to build. I know that some people have likened Soji to maybe a different language. So for people who aren't familiar, say, with using they, them pronouns, this is a new language that they have to learn. And we realize that. And so we want to keep training and keep the dialogue open throughout this process as another layer of protection.
Great. Now, finally, how can DFW community members join Simmons in promoting equity for our large LGBTQ population, and what are some resources they can use?
Oh, that's a great question. I think overall, I encourage people just to be curious and not make assumptions. I think, it's been a nice surprise, not really surprise, but moving back to Texas recently, people using y'all all the time. I think it's so nice because it's a very gender neutral way to address groups of people, right? But,
Yeah.
that same spirit is kind of helpful anywhere. Like, asking people how they want to be addressed or who the person with them is, and not just assuming that it couldn't be their spouse because of what the person's gender is, things like that. And I think things like having rainbow flags or pronoun pins or other signs to show that businesses or places are welcoming and accepting, those things do go a long way for the community. In terms of resources, I would say the LGBT Cancer Network is excellent. They're online. They have training resources. They have resources for people in LGBT community who are looking for things like cancer support groups or research studies to participate in. So that could be a helpful place to start. And more locally, I think the Resource Center is a great place to check out.
Yeah. Well, thank you so much for being on this episode of Let's Talk About It. Is there anything that you would like to close with, Dr. Mullins?
No, I guess I'll just thank people for watching this episode of Let's Talk About It, where we've discussed a few of the things we're working on here at Simmons Cancer Center to better equitably serve our community members with cancer.
All right. Thank you so much again.
Thanks.